Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'd like to answer the question, why am I breathless? So breathlessness is a very common symptom. Many people are short of breath and they don't know exactly what's going on. Now, normally what I would recommend, if you do suffer with breathlessness, the first thing you should do is try to see your doctor, especially if this is something that's been worrying you for a while. Also, for those of you who are a little bit older, please take into account the fact that just because you're getting a bit older doesn't mean that you should automatically be more breathless. So always try to compare yourself with someone of the same age as you to see whether you can actually keep up. Because, for example, if you're going for a walk with a friend of yours and you can't keep up with them, you tend to stop a lot more often, or you are a bit slower than them. It may be an indication that you should consult your doctor, especially if this has been happening in the last few months, for example, if it's something new. That being said, I'd like to just get into some causes of breathlessness and what we might think about when you go for a consultation. The first thing that I usually like to start with is something called deconditioning. Now, deconditioning just means that your body is adapting to a lower level of physical activity. And it's something that I like to start with when I discuss breathlessness because it's a very unrecognized cause for breathlessness. Especially during the COVID pandemic, there were a lot of issues with people who have been stuck in their houses for much longer. They were sat on the sofas for much longer, working from home, not doing their usual commute, not doing their usual shopping, walking, etc. And people actually became quite breathless after that. There was a large proportion of patients, for example, turning up to the respiratory clinic who were much more breathless than before after 1-2 years of lockdown. And it's a very sad fact, but it's something that I need to stress. It can creep up on you. So deconditioning can affect anyone of any age. And especially if we are sitting down at our desks all day long, we are working on our projects, we are a bit stressed, we tend to ignore the necessities of our body, what we need to do, that we need to be moving. We were built and born to be able to move, to have functional strength, to be able to do our daily tasks. And if we do less and less of that, if we always choose the comforts of our car, escalators, elevators, instead of taking the stairs, walking to the shops, doing regular activities, it may be hard to actually maintain a level of fitness that would otherwise make us not breathless. So this is really important. I always like to start with deconditioning, and please bear this in mind because it may play a role even in addition to other causes that I will talk about next. The second thing that I'd like to mention is that some people mistake breathlessness with anxiety. So this is something that can happen, especially if you are a very anxious person and you hyperventilate when you have a bit of a panic attack or things like that. It's important to keep in mind that that may also be one of the potential causes for breathlessness in your case. It may not be the only reason. So I wouldn't just disregard breathlessness, but I like to start with deconditioning and anxiety because I think these two causes are often overlooked and we tend to look at other things first, like lung disease, heart disease, etc., which are important to investigate, but we shouldn't forget the things that we may be able to influence ourselves by making lifestyle changes. So physical activity, taking good care of our thoughts and what thoughts we allow in our minds, this may actually help us cope with breathlessness much better, especially if these come together with other causes, which I will discuss next. Now, because I'm a respiratory physician, I will start with lung causes for breathlessness because we have many here and there may be a lot of conditions where you may have breathlessness. First of all, I'd like to start with acute infection. So someone who has a chest infection, pneumonia, they may be a little bit breathless. That's absolutely expected, and it's something that everyone would think about. Another condition, generally in younger patients, but also later in life, can be asthma. So asthma can affect people from childhood all throughout older age. There can be late onset asthma as well. Sometimes people may have more cough rather than breathlessness when they have asthma, and the breathlessness is usually variable. So some days are better than others. You may have asthma attacks in between periods where you feel absolutely fine. Another condition to think about, especially in people who are a little bit older, over 40 years old, who have potentially smoked or worked in environments with lots of dust or other occupational exposures, is COPD, so chronic obstructive pulmonary disease. And this is another condition that affects the airways, not in the same way as asthma, but it may cause some of the same symptoms. So breathlessness and cough are the main symptoms in this condition. Now, COPD can also be associated with emphysema. So emphysema is generally a component of COPD, but emphysema can sometimes be predominant. In emphysema, there is destruction of the lung tissue. So basically, this is most often caused by smoking for many, many years, 20 years plus. And generally, there are people who are predisposed to getting emphysema easier than others. Now, emphysema means that there are air spaces in the lungs that are inflated, and that puts pressure on the rest of the lung. So there's less space to breathe actually because of these air bubbles in the lungs, let's say. It's a bit of a rough terminology to use, air bubbles, but emphysema just means that the lung is thinning out, there's less space to actually breathe properly and to get the oxygen in. So this may cause you to be breathless. Other things that may happen in the lung is that some individuals develop lung fibrosis or interstitial lung diseases. Now, interstitial lung diseases are conditions in which the actual tissue, the spongy tissue of the lungs, becomes thickened, hardened. It's harder to stretch the lungs out. There may be scarring of the lungs, and this is what it means when we discuss about lung fibrosis, pulmonary fibrosis, lung scarring. So these conditions obviously can cause breathlessness as they become more and more advanced. Some of these forms of interstitial lung diseases can be progressive. They can be caused sometimes by inflammation, they can be caused by other conditions in the rest of the body, such as rheumatological disease, autoimmune conditions. They may be associated with interstitial lung diseases, lung fibrosis, but there may be also pulmonary fibrosis of an unknown cause, where we cannot identify the trigger, the cause, and we call this condition idiopathic pulmonary fibrosis. These are all conditions in which you can have breathlessness. The other thing to consider would be pleural disease, and this is when the lining around the lungs, there is a thin membrane that surrounds both lungs, and then that membrane sort of flips over and is on the inside of the chest. So it basically covers both the lungs and the inner side of the chest. And this membrane sort of sticks to each other. There's a little bit of fluid between the two membranes, and this helps the lungs stick to the chest. When we try to breathe in, this is how we stretch the lungs. It allows the lungs to expand, and that fluid lubricates basically those membranes, and it allows the lungs to expand properly. Now, this is a normal physiological feature. Now, if the pleura, this membrane that surrounds the lungs, becomes thickened, hardened, there may be fluid in that space in the pleura, or a bit of air potentially. These can all cause breathlessness. So there may be a lot of reasons for that, some of them infectious, some of them may be related to more serious conditions, some of them may be due to trauma or other forms of conditions outside the lungs that have nothing to do with the chest. For example, heart failure can cause fluid to build up in the pleural spaces, in these membrane spaces that surround the lungs. Now, moving away from the lungs, I'd like to talk a little bit about the heart. A lot of heart conditions can also cause breathlessness, and it may be regardless of the heart condition that we're talking about. It could be a condition affecting the valves of the heart. It could be uncontrolled hypertension for many years, causing the heart to sort of grow a little bit and not pump as efficiently as before. But in these situations, you get heart failure. Heart failure just means that the pumping function of the heart cannot keep up with the demands of the body. So, for example, when you are doing something really strenuous, you're doing significant exertion, you're trying to lift heavy objects, run, climb some stairs, etc., it may be that the pumping function of the heart cannot keep up with that demand by the muscles, by the rest of the organs of the body to increase the flow. And that's when you get a little bit breathless, because the blood cannot circulate and oxygenate well as it passes through the lungs and the rest of the body. On a slightly related note, we can also talk about something called pulmonary hypertension. Now, pulmonary hypertension, I've touched upon this in another video on my channel if you want to check that out. But basically, it just means that the pressure between the heart and the lungs in the artery that connects these two organs is increased. And that's when there is a little bit of an impairment in the circulation of blood from the heart through the lungs. And this is important because the blood that flows from the heart through the lungs will pick up all the oxygen that's absorbed by the lungs. So if there is high pressure there, the flow may be impaired. There's less oxygenation, especially on exertion. So this is very important. It's a common cause of breathlessness. It can be caused by many, many conditions. It can sometimes occur by itself without a known cause. But it's one thing that I wanted to include in this video. There can be also other causes. For example, people who suffer with anemia, they sometimes have breathlessness because the blood it can circulate well, everything is all right, the lungs are working fine, the heart is working fine, but the hemoglobin in the blood, which is basically the protein that collects the oxygen and transports it throughout the body, is at a lower concentration. So you can imagine that even if the blood flow is normal, you may not be getting the right delivery of oxygen to where it's needed, to the muscles, to other parts of the body. So that can also cause breathlessness as well. And it's important to understand that basically breathlessness happens when there's a bit of a disconnect between the demands of the body and what the lungs or the heart or the circulation can supply. On that note, there can be a lot of other causes for breathlessness. So that's what I mean by going to your doctor if you are struggling with this symptom, especially if it's something new, if it's something that's concerning. Go see your doctor to see what it is. In many cases, it's not necessarily something very serious, but it may be something that needs to be addressed. Hope this was helpful. If you have further questions, leave them in the comment section below, and I'll see you in future videos. All the best.